What's up everyone, Dr. Beau. Today we're answering your questions all about plantar fasciitis.
How can I help you today?
What's up everyone? Today's question is from Roshni, and Roshni asks, hey Dr. Beau, I am dealing with a terrible case of plantar fasciitis. What do I do about it? All right, Roshni, so we are going to tell you all about plantar fasciitis, what you need to do about it, the causes, and all the things that you can do right now at home to help take care of this plantar fasciitis. Okay, what is plantar fasciitis? I'm going to use Dr. Jordan here as our example, and we are going to talk all about what it is and now how you can address it. So let's go down to his foot and let's talk about what plantar fasciitis is. So plantar fasciitis is a structure on the bottom of your foot that attaches from your heel all the way to the different portions of your toes up here called your metatarsals. It's a big fan-like connective tissue that sits just right there. Now, what to do about plantar fasciitis? Now, the first question is we have to ask is, why is the plantar fascia being irritated? Because everyone has a plantar fascia, it just doesn't mean that it's going to inflame out of no reason. So something either needs to be pushing or pulling on the plantar fascia to cause the inflammation and to ultimately cause the plantar fascia to be irritated enough to pull off the bottom of the heel. Now, it can come from a couple of different things. The most common thing is that there is some sort of structural imbalance happening in the foot, or a structural imbalance happening a little bit higher up in the lower portion of the leg. Now, let's talk a little bit first about foot posture. I'm going to go over and grab my model real quick. All right, so a perfect foot posture is when the foot sits and you can kind of see how it has this nice little cave in here. And that is what we would call a normal foot posture. But most people are flat-footed, which means their arch has collapsed down there. And as we talked about, the plantar fascia starts here and inserts into these metatarsal heads here. And as the foot drops down, it causes a stretching and a straining on the plantar fascia, which ultimately causes an irritation at the bottom of the foot here. So the first thing that we can do for a person with plantar fasciitis is look at their foot posture. If they're flat-footed, then we typically recommend that they start with an orthotic, which helps to provide support for the foot. Now, the second thing I want to talk about is the functional aspects of plantar fasciitis. So we know that a lot of people have flat feet and they still don't have plantar fasciitis, so what ultimately is the cause? And the cause is this. The cause is a muscle that sits right here behind this big bone here called your tibia. Most of you guys know this as your shin bone, but there's a muscle that sits right behind it called your posterior tibialis. For you to find that muscle, what you're going to do is take your hands and just go on the inside portion of the tibia, and you can feel the muscle going all the way right behind the tibia here. This muscle starts up here on the back side, the posterior side of the bone, and it runs down, underneath, and over the top of the plantar fascia and inserts into the same areas that the plantar fascia does. What we see is that this muscle right here becomes very tight, and almost like a fishing hook, it will take and pull up right there on the plantar fascia, and that's what causes the irritation at the bottom of the foot. Now, I've seen tons of patients, tons of athletes that come in that have tried all sorts of different remedies for their plantar fasciitis, and ultimately, guys, this is the hidden key. This is the gem to the whole thing, is you got to get in there and you have to start to work and to release the back muscle here, this posterior tibialis. How do I do that? Well, I can do it with my hands by scraping and massaging it. I can also take a tennis ball and push it down into these muscles and irritate the muscles back and forth, or I can use a massage gun like a hypervolt to get the muscle to loosen up. Once we get the muscle to loosen up, we take the foot and we start working it through the different ranges of motion to help to loosen the bottom of the plantar fascia. And guys, that's what ultimately takes care of plantar fasciitis. So, just to recap, what is plantar fasciitis? It's an irritation of the connective tissue on the bottom of the foot going from the heel extending up to the toes. But the main thing that you have to figure out is why it's being irritated. Is it being irritated because our foot posture is now having a flat foot or a flat-footed posture they call pes planus? Or is it because the muscles a little bit higher in the lower leg have been overworked from too much running or jumping or causing some sort of strain on those muscles? If it is, I can almost guarantee it's all about the tibialis posterior. Get in there, work that, release it, and say goodbye to your plantar fasciitis. All right, guys, if you have questions, please ask them below in the comments. This is a super, super common thing that we see. And that tibialis posterior, guys, man, that's the key to the whole thing. Talk to you soon.